Greetings to one and all. I'm Dr. Madhana Madhubala, professor from SR Medical College. I'm here to present my topic on role of polydopamine in restorative dentistry, a review. Coming to the introduction, polydopamine is an emerging nature-inspired biopolymer material that possesses many interesting properties. It has got a dark brown black color, which is an insoluble biopolymer. Talking about its history, we know about this muscle marine animals. It can strongly attach to diverse substrates with a high binding strength even on wet surfaces. The scientists have long investigated the wet adhesion property of mussels. It was found that food proteins present near the plug substrate interface are the major origins of this extraordinary wet adhesion. So, the synthetic analog of this muscle adhesive protein leads to the development of polydopamine. So, polydopamine is the synthetic analog of this food protein, which is chemically named as 3,4-dihydroxy L-phenylalanine, which is shortly called as L-DOPA. It readily polymerizes on oxidation. It has got a very good wet adhesion property on natural, inorganic, organic, and synthetic surfaces with its robust functional groups present on its surface. Coming to the structure, it has got lot functional groups attached to its core structure like amine, thiol, imine groups, which is comprised of intra and interchain non-covalent interactions including hydrogen bonding, alpha stacking, and charge transfers. Coming to its formation, it forms as a result of combination of covalent self-assembly and covalent polymerization. If we mix dopamine 2 mg and 12.1 milligram of hydrochloric acid in a distilled water for 1 minute, and if the solution is kept open in the presence of oxygen, it immediately oxidizes to form polydopamine. So it can be formed typically in a very mild conditions. Their sizes are easily controllable. And coming to its properties, it has got absorption, fluorescence property, paramagnetism, electrical conductivity, metal ion chelating property, redox activity, and chemical reactivity. So these properties are made of use of in this most of the things in biomedical field and engineering field because of its advantages of high chelating capability towards the metal ions, and it can produce polymer inorganic core shell structures with durable functions in nanoarchitectures, and it can finely tailor the surface properties of core shell nanostructures. And polydopamine nanoparticles has been recently introduced in even increased mechanical and biological properties. So polydopamine derived hybrid materials can serve as a passive link to the surface of materials for improving the conjugation with moieties, and it can behave as both reducing agent and stabilizing agent for the construction of organic and inorganic hybrid materials, and it can act as a green carbon resource. So the fabrication broad application of this PDA-based materials have rapidly advanced recent years. It can even got a global acceptance in dental field also. So its significance lies in its assisting hydroxyapatite formation in enamel dentin, its strong adhesive property and good affinity to a variety of proteins and peptides, and MMP inhibition ability and antibacterial action against chiriogenic microorganisms, and stabilizing property against amorphous form of calcium salts. So these properties leads to the application of restorative dentistry as dental adhesive modification, anti-chirogenic agent, anti-plaque agent, and due to its tooth manipulation property, it can be used in the management of white spot lesion, dental hypersensitivity, and pulp dentin regeneration, tissue engineering aspect. So, whatever the application restorative dentistry, everything is in the research field. So, addition by PDA occurs by oxidation of catapulted quinones in the alkaline environment, leading to covalent coupling to organic surfaces via aryl-aryl coupling due to the presence of functional groups. So, most of the studies have tried this polydopamine to increase the adhesive ability of our dental adhesives. So, Ali et al. He found that cellular nanoparticle modified polydopamine with hydroxyapatite fillers increase the antibacterial malation property of dental adhesive with excellent potential stability and durability. And we incorporated this polydopamine inside Total Edge and a self-edge adhesive, which we proved that it has got anti-collagenolitic activity, MMP inhibiting activity, which results in stable resident bond with increased bond durability, and it even inhibits the growth, proteolytic and hydrolytic breakdown of resident bond degradation. And Prasanna et al. He has used this polydopamine as a surface pretreatment for post-surface in order to increase the bond strength between the post and the root canal dentin, which he proved that it has improved the both short-term and long-term bond strength. And combination of polydopamine coating to the peak crowns, which is the tooth-colored high-performance thermoplastic polymer for primary teeth, had a significant impact on the bonding property with good surface adhesion and good biocompatibility. And this PDA has been used as a therapeutic method for cell healing of cracked tooth. They have used this MFP proteins inside the cracked surface, which proves to have a self repair of this cracked tooth by capturing calcium ion from the saliva and thereby mineralizing by hydroxyapatite formation. And coming to the antibacterial potential by polydopamine, it has got a robust activation against antibacterial activity by bacterial cell adhesion, metabolic based nutrient exchange, release of ROS, nitric acid, and hydrogen peroxide, thereby dec- uh, increasing the cell damage and decreasing the cell permeability, so that it increases the delivery application, and it even prevents the biofilm inhibition. So it is being used to the prevention of root dentin caries by introducing a novel polydopamine induced polyethylene glycol coating on the root surface. It results in anti-biofilling effect and inhibits the salivary mucin absorption chorionic biofilm formation. And we have incorporated this and polydopamine inside the rootlet system, which has proved to be having a higher antibacterial potential against Streptococcus mutans when compared to conventional disease system. Then remineralization of polydopamine occurs by it acts as effective anchor units by HAP nucleation sites and by binding collagen fibers and preventing demineralization by its antibacterial activity in acting as a non-collagenous protein analog. Even this remyelination has been proved by so many studies. Ding et al. Proved that interaction between PDA and tricalcium silicate cements results in different biomedical applications, including cell adhesion, bone regeneration, antimicrobial activity. And most important thing to talk about polydopamine has it has got an ultra fast and accessible route to promote the kinetic deposition of hydroxyapatite within 5 minutes in SPF solution, so that it accelerates effectively the formation of apatite on any surface, and it even induces tooth remineralization by immersing a PDA coated enamel and dentin slices in calcium phosphate solutions. If in this diagram we can see a good hydroxyapatite deposition on the enamel surface and the tubular closure on the dentinal surface. And recently it has been proved that polydopamine even promotes dentin remyelination via interfacial control by decreasing heterogeneous nucleation barrier for hydroxyapatite by reducing the interfacial energy between collagen fibers and ACP precursors. And this PDA has also been used for dentin regeneration because of its action of cell adhesion and differentiation potential, signaling growth factors and biomolecules, and increasing the encapsulation patterning of cells. So, it has been coated on the mineral trioxide aggregate to and proved to have a long-term odontogenic differentiation on the substrate. And even this polydopamine nanoparticles has shown excellent affinity for protein adhesion, and it represents a versatile platform to modify porous scaffolds used for dentin regeneration by anchoring to immobilize cell adhesive molecules, signaling growth cascade, and creating suitable extracellular matrix microenvironments for cell attachment and differentiation. So, to conclude, the role of polydopamine has a great future in dentistry because of its diverse applications. It has got a good potential therapeutic additive. It can act as a very good potential therapeutic additive and in restorative dentistry to enhance material functionalization. But all the things which are pertaining to polydopamine still in research level, and definitely a clinical translation stands a very big future for polydopamine applications in restorative dentistry. Thank you.